great pleasure to see you all today. I have to look back to the time with NRHI was about 3 or 4 collaboratives that had monthly phone calls. That was the origin, so it's just wonderful. And see Ann Weiss in the back, who was very helpful in some of our initial funding to get started. So I'm going to be talking about measuring and reporting patient experience. Not only does patient experience, the care of experience matter to patients, it's really also the cornerstone to patient-centered care. And good patient experience, we know from research, is tied to better clinical outcomes. So is it just down?
Just push the clicker.
Okay. Okay. So MHQP is one of the oldest regional collaboratives in the country. This is our 18th year. And our mission is to drive measurable improvements in quality improvements, healthcare quality, patient experience, and the use of resources in Massachusetts. And we do this not only through collaboration, but also through the patient and public engagement. And this is an area that's been added recently to our activities. As a collaborative, we bring together those who provide care, those who pay for care, those who receive care. And over the years, we've developed really strong relationships with our physician community. As you can see, we've had, for the last decade, a physician council. These are physician leaders of the largest organizations in Massachusetts that come together and advise us on all our measurement work. We also have a health plan council, and in 2011, we established a patient and public engagement council, knowing that we really need the patient voice at the table much more strongly if we're really going to achieve the goals that we want to achieve in Massachusetts. And so we've always had a dual commitment to our work. One is to provide trusted information to physicians so they can provide better care, to help them better care for their patients, but also to provide trusted information to the public so they can better inform their decision making. And sometimes having those dual commitments brings real tensions to what we do, but we think it's a healthy tension. And we have earned the trust of all of these players because we work very closely with them, we listen to them, and that's made us an unbiased, by listening to them and the work we do, which is unbiased and neutral. And we have no agenda other than improving quality for Massachusetts. And we are statewide, and we report on about 4.5 million people out of the 6 million in Massachusetts. So our core measurement agenda, in the past, we've been publicly reporting on clinical quality since 2005. We report on 30 clinical measures and for over 150 medical groups across Massachusetts. Today, I'm going to be focusing on our patient experience work. We have been reporting since 2006. We report every other year, so in 2011, we completed our 4th cycle. We report on over 500 practices in Massachusetts, and we hear back from over 65,000 patients in Massachusetts make up the results of our survey. So this is a quick slide of what our website looks like. As I said, we've had this website since 2006. This shows some diabetic measures for adults, comparing a couple different groups on the clinical quality. And this is patient experience, how well doctors communicate with patients, how well doctors coordinate care, how well they know their patients, and how well doctors give preventive care and advice, and so a comparative ranking. So we have been working on patient experience since 1998. In 1998, we published the first in the nation survey of patient experiences with acute care hospitals. And then in 2005, we've started working on physician, and so we did the first in the nation survey of patient experiences with their primary care physician office. And so over the years, as I mentioned, we've had 4 separate cycles. Our most recent cycle that we had, we jointly published with Consumer Reports. There's a copy of the publication out in the hallway, and I'll be talking a little bit more about that. But we're really proud of the run we've done, and over time, patient experience has been more and more accepted as an important piece of quality. What the primary care experience surveys measure, there's 7 domains that we look at that characterize the patient experience, and these are based on what the Institute of Medicine has said is important to happen when you in a primary care physician office. And as we all know and talk about, primary care is really the cornerstone for navigating our healthcare system and managing care within the system. So this is where it all starts. And so if there's not good communication, if there's not good integration of care, if there's not good knowledge of the patient, if there's not health promotion, you know, we're toast before we even get started. So these are really key. We also look at organizational features of care, getting access, visit continuity, and how well the office staff responds to patients, which is important. So why measure patient experience? This is a quote from one of our physicians that we work with. If patients have a poor experience with their doctor, they're not going to come back for test results. They may not take their medications, and they may not learn how to manage things themselves. So this is really the key, and this is not just an anecdote. We know studies back this up, that with good patient experience comes better engagement and better adherence. And as I mentioned, patient experience is really a pathway to patient-centered care. We've all bought into the notion that the Institute of Medicine introduced in 2001, that care should be patient-centered. So if we don't listen to the patient, how can we possibly have a patient-centered healthcare system? So it's just as plain as that. A quote from another of our physicians: "The doctor is the medical expert, but you are the expert about you and your child. It's that collaboration between the doctor and the patient that results in the best healthcare for all involved." And I think we all believe this, but we don't do it very often. So I'm going to switch a little bit and share some of the impact of the measurement that we've been doing. This is data from our 2011 survey, which is the 4th cycle. So every cycle that we do, there's improvement, but also the variation goes down. So this is after a number, many years of hard work. In black is the adult results, and blue is pediatric. And as you see, communication, well, you probably can't see. If you read it right to left, communication is the highest with the smallest variation. There's integration of care, knowledge of the patient. Health promotion is the area with the biggest variation and the most lowest scores. Organizational access, visit-based continuity, and office staff. And so I want to share a little bit of the improvements that we've seen over the years, and these are really hard to move the bar, but it's been steadily gone up. This is adults, and one thing that's really key for Massachusetts is if you look, 2006 is when we passed universal access in Massachusetts, and so as you can imagine, sort of mirroring the national debate, there was, oh my God, we had 400,000 new people coming into the system. How is that going to impact me and my relationship with my doctor? There was no negative impact. The patient experience continued to rise, not only for adults, also for kids. Some of these lower measures on the kids' side are around the office staff. There's some organizational dimensions that practices are still working on. So I want to quickly talk about the work that we did. I mentioned that we published this data with Consumer Reports. We have been publishing this information on our website since 2006 for every cycle. But we've been disappointed in the number of hits that we get to our website, the number of people that actually look at this information. So, and we feel frustrated because we and all the regional collaboratives have really reliable information on physicians, and we want to share them with the public. So by partnering with Consumer Reports, who has a 75-year history of teaching people how to make decisions and understand sharing information, we thought it was an incredible opportunity. And so both organizations share values of sound data scoring, and also through Consumer Reports, our data went to hundreds of thousands of people. There are 120,000 Massachusetts subscribers of Consumer Reports. And I want to give a nod to Ann Weiss of the Robert Wood Johnson Foundation for funding this pilot that Consumer Reports worked with not only MHQP, but Minnesota and Wisconsin as well. And so this is the cover of the publication, and some of the responses were, this is what transparency looks like. Ta-da, we finally got it, because we publish this in a way that consumers want to see information. We published in the past the way physicians were willing to have it and the way physicians felt it should be published, but we're pushing the bar and saying, no, we need to really focus on what patients want and how they want to see it. This was an outstanding public service. Thank you. So what? So Massachusetts residents have a new resource to help choose the best primary care practices. It's a milestone in providing consumers with valid, reliable, and useful information. Let's hope the consumers take advantage of it. And then from a physician, any transparency like this can really only help raise the bar for the medical profession. So this is a snapshot of what the actual scoring looks like. And I don't have time to talk to you about how physicians react to little black balls in all of this, but that's another talk, and I'd be happy to share that with you. But I wanted to point out, in addition to the actual ratings, the editorial content around this was about education and educating people about what you should expect when you go to your doctor. And so Consumer Reports, the way suggested, why don't we pull out each question? So the first question, how did your doctor, or how often did your doctor explain things in a way that you could always understand? I mean, again, key to patient engagement. Never, usually, always. And then it said what the scores were in Massachusetts, which is 84%. And then it's like, well, what can you do to make this happen more often, you as the patient? Take detailed notes, repeat your doctor's instructions back in your own words to check that you got them. If you're confused, say so. Consider bringing a friend along. So it's really, it was a strong educational focus. And in terms of response, we had phenomenal response. Our Facebook traffic increased 700%. Our Twitter went up 200%. We had over 119 articles. In terms of web hits, it went somewhat viral. We had 4.5 million views of this. And the newsstand sales of Consumer Reports in Massachusetts, the month that we published this, went up 110%. So people want this information. They care about patient experience, and we made the effort to put it in a way that patients really can access. And we've been repurposing some of this to a lower literacy version to work with some of our community health centers and other populations. So really quickly looking to the future, I mean, it's been said before, but federal programs are looking to measure and reward, whether they be ACOs or patient-centered medical homes, patient experience and other. Do not ignore us. We have been doing this. We lead in this. You can work, we're happy to work with you, but don't reinvent the wheel and set up a parallel program, because it will create complete chaos in our market and others that are doing this. So we plead for that. And we also would like you to support our efforts to develop and test new and improved measures around patient reporting and patient reported outcomes. And then finally, many of the states own all-payer claims databases, and the feds have encouraged them to do this. There should be incentives for the states to work with the Regional Health Improvement Collaborative to get the data out in a meaningful way. So with that, I'll say thank you.